Okay, we're finishing up the airway and breathing course here pretty soon. Just a few more lessons left. And this is the second of two lessons in the restricted motion and access unit on spinal motion restricted, SMR, spinal motion restricted intubation. And that's what we're dealing with here. And so the big takeaway is that our patients come with collars on them in some cases, but that's not always for spinal motion restriction. We use auto pulse in our system, and so we encounter patients who have a C-collar on in order to limit their head motion from the auto pulse. It's not about spinal motion restriction. So just don't try to intubate somebody with the collar on. Take the collar off, at least remove the front. Don't have an intact C-collar causing you restricted access, whether it is for spinal motion restriction or if it's an auto pulse thing. Remove that collar, but you got to maintain manual spinal motion restriction in the case of the SMR patient. So the technique's real simple. It just starts differently. The airway operator goes to the head like normal, but they take manual stabilization. And then the assistant comes in kind of from the front at the chest and takes over manual stabilization. The airway operator needs to remind that assistant that the airway operator is going to be cranking and lifting in the opposite direction from what that assistant's trying to hold. So the intubation is the same as normal, although I think it's reasonable to expect that you're going to have a more difficult view. So here's a picture that illustrates it a lot better. You see the airway operator in the gray shirt, and you see the assistant in the blue sweatshirt, and she is holding spinal motion restriction from the front at the chest, so to speak, while the operator does his usual thing. Some tips on this. It's going to be an obstructed view. So, think about plan B, C, and D, and E, and F, and G, and think about those before you start. Remove that collar, get your helper to hold against your force, and use all your best techniques. Use your video, use your bougie, use your suction, use your external laryngeal manipulation. Use all the tricks you've got. This will be one of your harder intubations in all likelihood. The Moodle lesson that goes along with this has a video of those students. Those were students from our 2013 class, and they were gracious enough to allow themselves to be on video to help. So I think you'll see get a pretty good understanding of that, particularly after you do the regular Moodle lesson. So spinal motion or access restricted intubation.